Dear friends, so welcome to Alpha Physio Pelvic Care. Welcome back if you're a returning viewer, and welcome if you're a new one. My name is Anastasia Varova. I'm a pelvic floor physiotherapist, and I'm actually practicing pelvic floor for over 10 years now here in sunny Cyprus. Today, I would like to show you a very interesting set of exercises, stretches that are aimed specifically for cesarean section moms and specifically to work with the cesarean section in a no touch way. Why no touch? Before we continue, I would really appreciate if you hit that subscribe button. It helps me and motivates me a lot to create useful content for you, and here I'm sharing all my professional tips. Hit that subscribe button, press the like button if you enjoyed this video, and let's talk about no touch work with cesarean section scar. In my practice, I see a lot of cesarean section scars. Cyprus is one of the biggest cesarean section rates in the world, but it's a topic for another video. The fact is that moms come with me with it after the C-section, and they have very little knowledge about how scar can impact their health, and scar is already impacting their health, but they're not really sure why they have this back pain, why they cannot really do abdominals, why they have this pain during intimacy, and so on. And then when we start to look at the scar, to touch the scar, and they're like, oh yeah, that hits the spot, I can feel it now, or I can feel it better after we worked with the scar. So they come to me, I do my whole assessment, pelvic floor assessment, abdominal assessment, scar assessment, and I break the news to them. This is your C-section scar that's probably causing you quite a bit of symptoms, and we have to work with it. And often I will hear from moms saying, I don't really like to look at my scar, I don't really want to touch my scar, it doesn't feel good, it doesn't feel right, I just don't want. And I respect that. Usually there are reasons behind it. Women who do not want to touch their scar often had traumatic cesarean section experience. It could have been a very difficult emergency C-section. It could have been actually a planned cesarean, but the whole experience was just overwhelming for them, or the whole experience was actually very nice for them, but the recovery after was difficult. Various reasons. Some people, they just feel like they're gonna do damage because they don't know any better. Nobody explained to them how the tissue healing is happening, and they might come after 6 months and they still believe that their C-section scar is weak, and if they touch it, they might do some damage to them, which is not the case. I do respect and appreciate the fact that some moms, they completely don't want to touch their area around, and I will make another video how you can indirectly massage without actually going onto the skin with your fingers, your cesarean section scar. But today we're going to do a no touch stretch. So we're working on C-section scar, but we are not actually touching it. So let's go. As you can see, I'm sitting here with a ball, not for decorative purposes, but actually we're going to use one. I hope when you were pregnant, you got a ball, and I actually have quite few videos with a ball. So I think it's a great equipment just to have, to exercise on, to stretch on, to use it for your pelvic health. I also have a lot of videos on my social media, Alpha Physio Care on Instagram, where I utilize the ball. So believe me, if you get yourself a ball, it will not sit there, well, hopefully not. It will not sit there without any job, because this is great pelvic floor equipment. Ball is a great investment, although it takes a little space. Just get a ball. First thing first, of course, we want to stretch the area here. The cesarean section scar, it's done around this area. Even if you had a C-section scar long ways, usually I have seen some of them, usually it's people of a little bit older generation, but you know, things happen, you never know. Even if you had abdominal surgery, these exercises, non-C-section surgery, these exercises can be great. I forgot to mention, but this is an important thing to mention, is we start these kind of stretches after our doctor has cleared us. Usually it will be 6 to 8 weeks. The scar tissues are already well formed, and what we are going to do is we're just going to add them this gentle stretch. There is no sun movements here, very gentle stretch, so they don't form any type of adhesions that can give us trouble later. First, we start with sitting on the ball, and of course we want some kind of safe environment. Some people might find it a little bit difficult, but generally it's very easy-ish to go on the ball, to lay down on it. You go down and you also support your head. And here you first start with your knees bent, okay? With the knees bent and just taking the shape of the ball and just gently rolling. Whilst you do that, I want you to take nice deep breath into your belly, because we want to stretch this area here. You won't see my belly blowing up and down because I'm here already on stretch, but I am taking breath into the belly. And you can do it for a minute or so, because if you stay too long with your head back, you might get dizzy. So we take a minute or so, and then you slowly can push yourself into more stretch and completely open up the front here. Remember, you want to have your feet in a non-sliding state, so probably socks off. And I'm here just gently rocking, staying in this position. If it's too much for your head, you can always come back, return, stay here for a moment, and go back into the stretch. Nice deep breath into your belly, rocking, rocking, rocking. I'm not getting very dizzy, so I probably will stay here for about 30 seconds and then go down. And I will repeat it 5 to 6 times. So as you can see, I am stretching my front abdominal wall, my cesarean section scar, but I'm not touching it, okay? And you can do these stretches every single day. Second stretch, we're going to stretch cesarean section scar, one side each. Quite often I see the scars that are not just clear, straight cut in the middle. Sometimes they go a little bit more left, sometimes a little bit more right. Most of the times right. That tells me the surgeon was right-handed. And there is a little bit more stitch on that right side. Regardless of that, we will stretch each position here. And what we are going to do is, we're going to first come onto one knee and let our left leg, so this is my right leg, this is my left leg. We're starting with stretching the left side. I'm not dropping down on the ball, okay? We want to do it in a steady, controlled manner. So I'm pushing the ball into my hip, I'm holding it, and I'm taking my body on the ball here, supporting my head. So far, so good. Right now, I don't feel much of the stretch here, but I got myself on the ball. Then I'm stretching my left leg slightly backwards and my left hand behind. And I'm leaning forward, so I'm creating arch in my back, same time dropping on the side, taking the shape of the ball. So I'm staying here. A deep belly breath. I already feel this side stretchy. You can rock back and forwards. Okay, you can rock gently back and forward. If your ball is like short enough, small enough, you can support yourself with the hand if you want to. I don't feel the need to do that. I think the balance is okay here because you're on the whole knee here, breathing in and out. And I will do it for a minute or two in here. Forward, hold it, nice deep breath in. The more back you go, the more stretch you'll feel. So this is similar to what we did first time, but we're giving emphasis on each side. Then you're getting yourself in the same position, left leg, right hand, right leg. You're dropping down here, stretching after, and reach. So remember, you go back and shape of the ball. So you go breathing in, back, and to the shape of the ball. And this is where you will feel the stretch here. You can stay here a bit, give it a bit more rotation. Or you can stay just on the side and breathe into your belly. I really feel here in my left side. And if I would have here a cesarean section scar, it would definitely give it a good stretch. All right, great. Let's move to the next one. And we're moving on. Next stretch will be through the movement. So we're going to relax the tissues and extend the tissues. And the important bit here, again, move into slow movement, slowly going back. We don't want to overstrain our back, overcompress it, and work definitely with the breath. So we're going to breathe in here, completely relaxed. And as we breathe out, we take the ball, press our pelvis slightly forward, tuck our tailbone in, lean back. Breathe in and breathe out. And quite often, I've seen moms who, after a long time, lifting your chest here, will still be in this semi-flex position, and this already will be normal for them. They will feel like I'm straight. But in fact, if I'm getting them straight, they're like, wow, I feel like it's all pulling here. So this is why we're getting ourselves into this slightly overstretched position. So we open up the front wall, breathing in, breathing out, extend through your low back and through your chest. Feeling the stretch here. Breathe in and breathe out. Extend until you feel the release. I hope you tried these stretches. Let me know how they feel. Let me know, did you feel the stretch? Was it uncomfortable, or you're not really sure if you felt anything anywhere? Let me know, what is your experience through your C-section? Did it give you any symptoms? Did you suffer from any pain or any restricted movements? Definitely subscribe to my channel, because I will be posting more on C-section scar work. I also have a whole separate online course on C-section scar recovery, where I give 17 videos, short videos, on how to indirectly and directly work with the C-section scar starting from day 0. It contains simple techniques and simple exercises that will take you around 7 to 10 minutes a day, no more than that, and can make huge difference to your recovery and to the way you feel around the C-section scar, and later on the way your core works. Thank you guys for watching. Thank you for your likes, comments, and subscriptions. Thank you for supporting what I do. Thank you very much, and we'll see you back very, very soon. Bye.